Hey there, if you're somebody who has numbness and tingling in your thumb, your index finger, your long finger, and half of your ring finger, maybe, if you have numbness, if you have tingling, if you have pain that wakes you up at night because of your fingers, you might have carpal tunnel syndrome. And my name is Huang. I'm an occupational therapist and certified hand therapist. I want to share with you a little bit of what you can do to get rid of carpal tunnel syndrome so that you can avoid injections and really, at the end of the day, avoid surgery. So what happens over time with carpal tunnel is you'll start to experience the sensation differences. It's going to feel like a slow onset, meaning like it's going to come, it's going to go, it's going to come, and it's going to go. And sometimes it's going to come on and just stay on. So it's something that develops over a long period of time. You might think like it just came on. Maybe that's true, but majority of the time it can start very slowly and then over a period of time get worse and worse. And with carpal tunnel, sometimes you think it's going to go away, but this time it's worse. One of the questions I've been getting is, can Shockwave help me with my carpal tunnel? Well, I'm here to answer that question. My name is Huang. I'm an occupational therapist and certified hand therapist here at Hands-On Therapy Services. And we've been using Shockwave for so many different types of muscle tendon issues. And somebody was like, does that help with a nerve issue? And here's my answer. Here's my quick and dirty answer. Yes, it can help. And I'm going to take a little bit of a moment to explain why it does help and how you can get rid of your carpal tunnel. There's a lot of ways to get rid of carpal tunnel. You can wear a brace and see if that helps. My recommendation is you can wear the brace for about a month. If it doesn't go away, then that is not the actual problem or the only problem. And then you'll want to discover further along what else is going on so you can get rid of that, the numbness and the tingling that you feel in your fingers, the pain that wakes you up at night. So if you fall asleep and you compress on that nerve in the night, then it's going to be painful and the pain is going to wake you up. And what happens is like it interrupts your sleep. It doesn't feel good. And sometimes you wake up and your fingers are all numb. That's definitely not good either. So let's get rid of it. You can really avoid surgery at the end of the day. So with the Shockwave machine and the treatment, the way it can help you get rid of carpal tunnel syndrome is by not moving it over the nerve, right? The nerve of carpal tunnel is here at the wrist. I was drawing on my hand for other videos, but it's here, right here at the wrist. We have a little band that holds everything. Think about it's like a rubber band that holds some of the tendons that go into your fingers, and also that nerve sits right in the middle. And so that rubber band gets really, really tight here at the wrist. Now, the funny thing about the nerve is it actually starts in your neck, comes down your shoulder. That nerve specifically passes in the middle of your elbow, comes down your arm, and sometimes it gets stuck right here in that wrist area. But the thing with a nerve that's unlike any other structure in your body, it's one piece all together. Think about your strand. It's one long strand and it's all connected. But with carpal tunnel, it's getting stuck right here. But is it really getting stuck right there? Well, that's what Shockwave can do. Shockwave can start the treatment and say right around your wrist, right around the muscles that can be choking that nerve to death. And the best way to treat using Shockwave is to follow the path of that nerve from your hand to wrist into your elbow, into your shoulder, and see what other structures are compressing or choking that nerve. So if you're going somewhere where they're only treating you at the wrist level and they're just saying, oh, just wear that splint, wait until it gets so bad and then insurance can pay for your surgery. Because if you're experiencing it's only mild, then most of the time they're not going to do the surgery because it's only a little bit. They want to wait until it's moderate to severe choking of that nerve to really do anything about it. But listen, I don't know about you, but I wouldn't want to live with that pain. I wouldn't want to live with that numbness. I myself have experienced it from another nerve, and it's so uncomfortable. You can't do anything. It just kind of messes with your brain, right? And so the way that we would use Shockwave is to address not just only at the wrist area, but we're going to follow that nerve up to where it started with and see where we can fix those areas and stop that choking, right? If you're going somewhere and they're only focused right here and you keep feeling the symptoms, it's because they're only going right here, and that's why you keep feeling the symptoms, right? Nerves are really, really funny. They're like your sensitive friend. You can't be too aggressive, but you can't be too easy. It's got to move just real nice and easy. And nerves, like your sensitive friend, won't say anything to you at the moment that it's happening. They're going to tell you later. Their feelings are hurt, right? So that's what happens with nerves. At the moment that you're moving and you're exercising, you're like, oh, it's fine. I feel nothing. Nothing is wrong. But your pain hits you at night or it hits you the next day. That means you've been going way too hard on the nerves. So Shockwave, just like any amount of therapy, Shockwave is controlled in its intensity. Just like you turning up the volume or turning down the volume, just like when you're doing weights, you can go from 1 pound to like 200 pounds, right? So everything needs to be essentially fitted to fit you, right? Not every single time I've seen a carpal tunnel syndrome on a patient, it's always something different. It's never exactly the same because our bodies don't move the same. The activities we do are not exactly the same. And so when it comes to using Shockwave or any form of therapy to help you get rid of carpal tunnel syndrome, think about, the therapist that you're working with should be thinking about exactly where the root cause is, what's going on, and then dials it up and dials it down in terms of intensity based on what you need, no more, no less. All right. So if you are someone in the Miami area and you're suffering with carpal tunnel syndrome and you want fast relief, Shockwave gives you fast relief that there's no downtime, there's no side effects. And if it's truly compressed due to muscle issues, Shockwave is really, really great. Now, your carpal tunnel might be from something else, and if it's something else, then we're going to do a full-on evaluation, see what's causing your carpal tunnel. Then we'll help you determine if Shockwave is the right treatment method for you, or if it's another type of treatment method for you that can be more effective and faster, right? We want to get rid of shit fast. We can't be here all day. Again, my name is Huang, and if you're in the Miami area and you're suffering with carpal tunnel, then give us a call here at Hands On Therapy Services and let us know how we can help you. Now, I have written a free guide on what Shockwave is all about and how it can help you. The link is below. Just go ahead and grab it. I'll see you next time.